Hello, I'm Dr. Maury Markman from City of Hope, and I wanted to briefly discuss one additional trial that was presented at the ESMO meeting. Actually, a complex study and an interpretation that is not quite as straightforward as, for example, the studies I noted previously. This study, entitled NGOT EN11 GOG 3053 Keynote B21. It tells you had a lot of investigators on the trial. A phase 3 study of pembrolizumab or placebo in combination with adjuvant chemotherapy with or without radiotherapy in patients with newly diagnosed high-risk endometrial cancer. Already, we know we have an issue when we are talking about high-risk endometrial cancer because that's not terribly well defined. There are a lot of definitions. We have to deal with questions of surgery, subtypes. Does it include grade 2, just grade 3, serous cancers? So it's a heterogeneous population. However, we recognize there's a high risk of recurrence in a population of endometrial cancer. Most patients with endometrial cancer, the risk of recurrence actually is relatively low because most endometrial cancer is low grade, surgically taken care of. But there is a population that we recognize, not terribly well defined, that there is the high risk. We also don't know exactly the benefits of adjuvant chemotherapy in this setting. We often use it. I certainly have used it in my career routinely when I know there's a high risk. I would give, platinum-based, platinum paclitaxel chemotherapy, but does it have an impact? How big an impact does it have? It's recognized as being important and widely used. So I want to say that before I go into the trial, because this relates a little bit to, for example, how do we determine who was injured? And therefore that has a question of how do we interpret it. So noting that, as stated by the investigators of this study, is that we know now that based on excellent results, excellent studies, actually a number of studies have been done looking at different checkpoint inhibitors, that the addition of checkpoint inhibitors, and specifically we're talking about here about pembrolizumab, significantly will improve PFS in endometrial cancer in the advanced stage metastatic recurrent setting. So the question there for the investigators asked, well, what if we use it earlier in this so-called high-risk adjuvant setting? Patients who have been surgically cytoreduced to no residual disease, but who have other risk factors. So that's what this phase 3 trial was designed to look at. So the study looked at very straightforward design, complexity on how you define the entry criteria, but once you define what is high risk early stage disease, patients are randomized to either carboplatin and paclitaxel. Obviously, radiation might be given to some of these patients, but carboplatin and paclitaxel as your chemotherapy backbone. Both groups, the control group and the experimental group, receive the therapy. And in the experimental group, the patients also receive pembrolizumab, 200 milligrams every 3 weeks for 6 cycles. And there was another group as well that was 400 milligrams every 6 weeks for 6 cycles. That was in the second stage of the trial. The bottom line here was that there was no improvement in disease-free survival seen in the entire population if one takes all patients together. There was at 24 months, as one can see when one looked at actually the survival curves that they demonstrated, they were really almost on top of each other. However, if one looked at two well-described subgroups, and this patients were stratified for this in the trial, those were patients who were proficient mismatch repair versus deficient mismatch repair. One saw, and you might say, not surprisingly, a favorable impact of the checkpoint inhibitor in the population that was mismatch repair deficient. Again, early results, abstract data, but one could see at 2 years a rather impressive, but again, numbers are relatively small, improvement in disease-free survival was 92% versus in the patients who received pembrolizumab versus 80% the patients who did not receive the pembrolizumab. Again, that's in the deficient population. In the proficient population, there was no difference. The curves were really almost atop each other. It is noted that about a quarter of patients in this setting, in endometrial cancer, in the experience of this group, in terms of looking at these high-risk populations, about a quarter of the patients have mismatch repair deficient tumors. So this is not an insignificant population, but it is a smaller population. So again, what conclusions can one draw from this? Well, first, very appropriately, the investigators stated that the addition of pembrolizumab to adjuvant chemotherapy did not improve disease-free survival in the all-comer intention-to-treat population with newly diagnosed high-risk endometrial cancer after surgery with curative intent. However, in this pre-specified group, by stratification, if one looks at the mismatch repair deficient population, there was an improvement in disease-free survival. In fact, the hazard ratio was 0.31. Again, recognizing the total number of patients here is not extremely large, and the follow-up is relatively immature. And in fact, there was no overall survival data to be presented because of the immaturity. They noted that, as anticipated, the safety profile of this particular regimen was manageable. Not surprising, this combination has been used before. And, you know, the data, again, the final conclusion was that the subgroup analysis suggests, I use the word suggest, that's I think all you can say at this point, a clinically meaningful benefit in the population with deficient mismatch repair on the disease-free survival. Whether that's going to be translated into an overall survival advantage remains to be seen. Again, an interesting paper, an interesting analysis. Further follow-up is certainly indicated. There may be something very important here, but only time will tell whether the use of therapy in this particular setting improves overall survival in endometrial cancer. And I thank you for your attention.